Our Destiny, thank you very much. Well, for many women, their menstrual cycle can be painful, but for about 1 in 10 women, that pain can be intensified each month by endometriosis. Dr. Brandy Patterson is an OBGYN with Brookwood Baptist, and she joins us this morning to talk more about that. Good morning.
Good morning.
It's good to see you. Endometriosis, just explain what that is.
So endometriosis is a condition in which women have extremely painful cycles or menstrual cycles and pelvic pain in other parts of the month as well. It's where tissue that typically is supposed to be inside the womb or inside the uterus, tissue like that, spreads and affects tissues outside the womb, like the bladder, the bowel, the ovaries, the peritoneum, and it can just cause severe pain.
So it's causing pain throughout part of the body then?
That is correct. It can affect the entire, definitely deep in the pelvis, but even the entire abdominal wall, the entire abdomen during any hormonal changes.
And are people, one person over than another, more susceptible to it, or what happens? Why do people get this?
Very good question, and that's something that we wish we could really figure out. We know that it can be genetic, so if you have a family history of anyone who has a history of endometriosis, it does put you at slightly higher risk, but it can also just occur sporadically. We don't really know exactly why that is.
And so what are the symptoms that women first have?
Very good question. So symptoms are typically really painful periods, and a lot of women have some cramps with their cycles, but this is debilitating, affects their daily activities.
They can't function really.
Correct. Of course, bloating, changes in bowel habits, pain with bowel movements, infertility, just to name a few.
And so when you are diagnosed with it, what happens then?
So once you're diagnosed with endometriosis, the goal is management of symptoms for women, depending on what particular moment they are in their life and what their plan is, if it's fertility or if it's just control of the pain with the menstrual cycle to keep them functioning. That's kind of the next step to figure out which therapy would be best for them.
Surgery, is that something that happens often, or is that a last resort?
Very good question. So it kind of again depends on if we're dealing with infertility and that's the primary goal. Surgery might be a first step for those women for diagnosis and management. If it's a younger woman that has clinical suspicion of endometriosis, then you may start with some of the medication options and some of the management strategies for just suspicion and see if she improves. If she doesn't, then you may have to move towards surgery.
So one of the things that you say that when you were sending us some information about what we needed to talk about, you said one of the key points is do not suffer in silence. And do you say that because a lot of women don't talk about it or don't mention what's going on with their doctor?
I really do. That's when I think of endometriosis, seeing so many patients for so long, I really do think of silent suffering because women just think, oh, I'm one of those unlucky people that my cycle is so bad. And it can be debilitating, and they think that's just part of what's natural for them when actually there's a cause that can be treated and we can give them back that quality of life.
So you can have a difficult menstrual cycle, but you can also have something else going on that needs to be addressed, which is like the endometriosis.
Correct.
All right, does it cause any long-term issues besides infertility and those type of things if it's not addressed?
Very good question. So again, infertility is one of the primary issues that it can cause if untreated over a prolonged period of time. But it also, the reason it causes infertility is it can cause scarring inside the abdomen. So it can affect bowel function. It can affect, if you have surgery for other issues in the future, you have more adhesions, more scar tissue to make surgery more risky.
So it's really detrimental to have it treated.
Correct, so not have it treated, right? Yes.
You need to have it treated. So anyone watching right now, if they feel like they have any kind of symptom, just ask their doctor about it, I would assume.
Absolutely. I would make an appointment, talk to your gynecologist about your symptoms and what might be the next steps.
All right, Dr. Brandy Patterson, OBGYN at Brookwood Baptist. Good to see you.
Good to see you. Thank you.
All right, we'll take a break and we'll be right back.